Next, we're going to talk about the female sexual response and then finish out the rest of chapter 26. So the female sexual response is initiated by touch and psychological stimuli. Things like the clitoris, vaginal mucosa, bulbs of the vestibule, and the breast would engorge with blood and the nipples would become erect. It is the vestibular gland secretions. Again, the vestibular gland is going to be similar to the bulbourethral glands in male that lubricate the vestibule. The vestibule is going to be in the recess of the labia minora, and then orgasm is accompanied by muscle tension, increase in pulse rate and blood pressure, and then rhythmic contractions of the uterus. So females have no refractory period after orgasm and therefore can experience multiple orgasms in a single sexual experience. But an orgasm is not essential for conception. We also have the adrenal cortex hormone DHEA or dihydroepiandrosterone that is able to prompt the female libido. Now we want to talk about sexually transmitted infections, or STIs, also known as STDs, or sexually transmitted diseases. Another name for them is venereal diseases, or VDs. In the U.S., we have the highest rates of infection among developed countries for STIs. Latex condoms do help prevent the spread, and the single most important cause of reproductive disorders is STIs. Gonorrhea is commonly called the clap. It's important to know it's a bacterial infection. It's a bacterial infection of the mucosae of the reproductive and urinary tracts, and it's spread by contact with genital, anal, and pharyngeal mucosae. The number of cases in the U.S., luckily, are declining. Signs and symptoms of gonorrhea are different for males and females. So for males, we would have inflammation of the urethra, possibly painful urination, and even the discharge of pus. But in females, 20% display no signs or symptoms. There may even be kind of random symptoms such as some just slight abdominal discomfort, but there's also vaginal discharge or abnormal uterine bleeding that could be signs and symptoms of gonorrhea in females. A more severe sign and symptom would be the resultant pelvic inflammatory disease and then sterility that can occur in females that become infected with bacterial gonorrhea. Treatment is antibiotics, but unfortunately there are many resistant strands of gonorrhea and they're becoming prevalent. Syphilis is also a bacterial infection and it's transmitted sexually or contracted congenitally. Infected fetuses are generally stillborn or unfortunately die shortly after birth. Now, the infection can be asymptomatic for up to 3 weeks, and then a painless canker sore appears at the site of infection, and it usually disappears in about a few weeks. So some people can ignore even the canker and not realize that they could possibly still pass on syphilis to others. Also important to know, syphilis is bacterial like gonorrhea. So syphilis, if untreated, does cause some secondary signs or can, and they generally appear several weeks later, even after the canker has kind of resolved itself. So they appear about 3 to 12 weeks, but they also then disappear. Those kind of secondary symptoms are a pink skin rash, fever, and even joint pain. All or none could be apparent. And then there's a latent period where we might not see tertiary syphilis, but individuals that do develop tertiary syphilis generally get gumas. Gumas are lesions of the central nervous system, blood vessels, bones, and skin, and definitely need to be treated, and the common treatment is penicillin. Chlamydia is also a bacterial STI. So we have gonorrhea, syphilis, and chlamydia that are bacterial STIs. And chlamydia is the most common bacterial STI in the United States. So about 50% of all diagnosed cases of pelvic inflammatory disease have their cause somehow rooted in chlamydia. Symptoms include inflammation of the urethra, discharge from the penis and the vagina, abdominal pain, rectal pain, and testicular pain, even painful intercourse and irregular menstruation. It can even cause joint pains or arthritis or urinary tract infections in men. In women, it can be as severe as enough to cause sterility, and newborns actually can contract chlamydia in the birth canal. Trachoma is a painful eye infection that newborns can contract in the birth canal. They can also get respiratory tract inflammation in the birth canal. Treatment is tetracycline, another antibiotic. Now, trichomoniasis is the most common curable STI in active young women in the U.S., and it's parasitic. So we're moving to kind of a different type of STI. Trichomoniasis is a parasitic infection, but it's really easily and inexpensively treated. But it can cause yellow-green vaginal discharge. It would have a strong odor, but unfortunately some individuals will be symptomless. So trichomoniasis was parasitic. Viral infections include genital warts caused by HPV or the human papillomavirus, and this is the second most common STI in the United States. And it unfortunately causes increased risk for cancers in certain infected body regions, such as cervical cancer. And it's linked actually to 80% of cases of invasive cervical cancer, but we do know that most strains of human papillomavirus do not cause cancer. The treatment is a vaccine called Gardasil, and it can be controversial because it's recommended to 11 and 12-year-old girls. Another viral infection is genital herpes, and that's caused by the herpes simplex virus 2, which does have latent periods and flare-ups. So congenital herpes can cause malfunctions of the fetus, so you can contract this in the birth canal, and a treatment would be acyclovir and other antiviral drugs kind of treating the symptoms, making sure it doesn't spread, but the latent periods and flare-ups are characteristics of any herpes virus or herpes virus. And that's it for the reproductive system, chapter 26. Make sure to go back and review all parts A through C.